Welcome back to the Arise interview, where we hold the best of conversations and analysis. Another new variant of coronavirus has emerged in Nigeria. Africa's leading public health officials have said the strain is emerging as Nigeria reports recorded numbers of coronavirus cases, with 1,133 recorded on Wednesday, though the new variant is not thought to be behind the COVID surge in the country. According to our sister publication agency, This Day Newspapers, a senior official of the Federal Ministry of Health says the new COVID-19 variant has not yet become a major threat. The head of the Africa Center for Disease Control and Prevention, John Nkengasong, says the variant found in Nigeria is different from those found recently in the UK and South Africa.
How dangerous this virus is, this is what we know about the virus so far. It transmits quickly. That is why it's actually responsible for a vast majority of the second wave in South Africa. The viral loads are higher that is the burden of virus in an infected individual is higher amongst people that are infected with this variant.
All right. Well, for more on this, I'm now being joined by Professor Bola Olayinka, an infectious disease expert and public health specialist. Good to have you. And how have you been coping yourself? I mean, because you're not immune from all of this, despite being an expert.
Yeah, I mean, we're not all immune, so we all have to do what we need to do to prevent transmission of the infection.
Now, let's talk about the strain that's coming up. A lot of persons have have been in panic mode since we started hearing of this strain. One of the researchers actually said that it had been with us since August, and now we're hearing that looks like there's another strain differently from that, and it looks like this one is different from that of South Africa and that of Britain. How should an average Nigerian actually look at this issue?
Okay, so in terms of having the variants, I really won't call it a strain because we don't have a different strain, we have variants. But these are things that happen naturally in viruses, because viruses, as they reproduce, they get new mutations, and those mutations may bring about variants. So there has been news that a new variant was discovered in Nigeria, okay, but we don't know anything beyond that. Africa CDC made a telebroadcast, but our Federal Ministry of Health and the NCDC have not said anything about that. But for me, I think what is important is that irrespective of what variant it is still the SARS-CoV-2 that causes COVID. And what's important is how do we reduce the transmission of this infection? And that is really what we as Nigerians need to focus on. Unfortunately, a lot of people are not doing the simple basic things that will prevent transmission.
And that's because they did it some time back when we had a lockdown and all of that. And after the lockdown, a lot of people just said it wasn't existing, and they still don't believe it is existing.
I really don't think they did it during the lockdown. One of the gaps that I saw during the lockdown was that there wasn't enough awareness to the people on why there needed to be a lockdown, what the lockdown was meant to achieve, and what we needed to be doing irrespective of the lockdown. But that message now needs to go out more than ever before. What should we as Nigerians be doing to reduce transmission of COVID? Whether it's this variant, whether a new variant will come on, it's still going to be the same prevention measures that we need to put in place.
One of the major challenges that we have is that testing remains very, very minimal. Only a very few states are testing fully, despite the increase of labs. And a lot of Nigerians don't want to even subject themselves to this test, and it's very expensive. What do you think we can do to encourage more testing?
Now, if you say it's very expensive, the one with regards to public health response is actually free. You don't pay for that one.
Yeah, the queue is so long that you wouldn't want to wait yourself.
I think there are quite a number of things that we need to understand. I think our states actually need to get up and take responsibility for taking care of their own people. Yes, you have a lab, but you need to pay the workers. You need to source for the reagents. And I think these are some of the challenges that states have not taken responsibility of. So what happens is a lot of samples are being shipped from many states to one or two labs. which also means that there's a delay in testing. The other thing which you mentioned, which is important, is the fact that people are not even going for testing. And we need to encourage people to go for testing. You know, it's like they say HIV no they show for face. The truth is, even COVID, until you test, you really don't know. And one of the challenges we have at this time is that when people have fever, upper respiratory tract infection, they'll say it's due to the change in weather. But it might not be.
Yeah, I mean, it's happening so much.
Yeah.
Myself, not quite long. I had this, and then the first thing someone told me is that it's because of the change of weather. Don't be scared. It's not COVID and all of that.
Yeah, but it could be, and you would not know except you test. And the reason why it's important we test is that if you don't know you're positive, you're going to go around sharing it to people.
Yeah,
That's
but we have
really
a youthful
happens.
population, and this is not active among the youthful population. So because of that,
No, we won't say it's not active.
they just feel it's actually something for the elderly to be afraid, not for young people.
No, but we have young people who have died from COVID. We have children less than 1 year who have died
Not so
from
much
COVID.
in Nigeria.
No, I'm giving you Nigerian data now. I'm not talking. There may not be many, but you see, if it affects you, if it's your child, if it's your parent, it would mean a lot. So we still have people below 5 years, below 1 year, who have died from COVID. There may not be many, but they are children, they are lives that matter. And you never know who the next one will be. And so that's why we still need to keep making efforts to prevent transmission of the disease.
Let's look at the plans by the Nigerian government to actually acquire, any of the vaccines that have been, introduced globally by different pharmaceutical companies. What would you advise Nigerians to do? Should they start preparing ahead of that, hopefully maybe from January? And there's also this controversy whether citizens should accept that vaccine or not, based on religious or political or even social beliefs.
Well, one thing is that vaccines are the best prevention that anyone can have, especially if the vaccine is effective and it works. I mean, that's why, for example, during meningitis, you take meningitis vaccine. That's why if you have a wound, you want to take tetanus vaccine, because we realize the importance. So vaccines are actually important, and people should have that mindset that vaccines are the best prevention we have. Of course, like anything, even paracetamol has its side effects. So some vaccines may have side effects, but I know that what's happening is that there's a lot of efforts. The World Health Organization, even the vaccine companies themselves, are making a lot of effort to make this as safe as possible for people. They're doing a lot of trials. We already have people in UK and in the US who have taken it. They're still being monitored to see what may come out of it.
Yeah,
So
would you take one when it becomes available?
I would. I actually would.
Okay. Now let's also talk about the politics of some state governors actually saying that this doesn't happen. We've seen Kogi State governor making it even a state policy that it doesn't exist, and so he wouldn't allow NCDC officials into the state. What would you advise citizens in that state to actually do?
You know, there's this saying about an ostrich that buries its head into the ground, to say that because I cannot see, no one can see me. But the ostrich being big, yes, the head is buried under the ground, but everybody else sees the ostrich. I think at this point in time, people should not, just want to say because I've said something, I'm taking a stand. Everybody is allowed to make a mistake. In life, we learn and we move forward. So if people have made utterances in the past that were mistakes, they should be man and honest enough to say, look, we thought this wasn't happening, but the dynamics have changed. But I can tell you that COVID is real. I've seen people who had COVID. I know people who have died from it. And so COVID exists, and we all need to put our hands on deck to work on reducing
Just before we go,
transmission.
very quickly now, what will you say about the global politics of the vaccine distribution and all of that? Some countries don't want to sell it to Africans and all of that. What should be done by Africa and, for example, Nigeria to access such vaccine?
I wouldn't say they don't want to sell it to Africa. The way it works is there are countries who have paid money in advance, and so it's a business in a way for the vaccine producing the manufacturing companies. So if somebody has paid, they get served first.
Okay.
But the World Health Organization developed in conjunction with Gavi and CEPI, they have what you call the COVAX facility.
All right, I'm told we do not have enough time.
Okay.
So definitely it will be sold once it's completed.
The aim is to make access available to all
right.
countries.
Thank you so much. Well,
Okay,
I want to
you.
thank you, Prof, for taking time to come out to be on the show. Well, that's how it's been for this edition of the Arise interview from me and the entire team here in Abuja. Goodbye and thank you for watching.